So someone wanted to know about tobacco amblyopia. And amblyopia just means the eyeball is normal in appearance. It's used to describe the lazy eye of childhood, but sometimes it ends up being used as a substitute for vision loss. So I actually don't prefer this term. I prefer the term tobacco optic neuropathy. And tobacco optic neuropathy is often paired with tobacco alcohol optic neuropathy because people who drink often are the same people who smoke. The differences are the alcohol-related optic neuropathy is a nutritional optic neuropathy. So it's usually because they're not having enough B9 or B12. And this produces the optic neuropathy because that is the highly metabolic papillomacular bundle, requires the vitamins, and so you get a central or secocentral scotoma, loss of center vision. There's not going to be an RAPD if it's bilateral. The nerve looks normal, and that's why they called it amblyopia in the past. The fundus looked normal, but then over time, the nerve turns pale in a sector fashion just in that papillomacular bundle. So the tobacco alcohol optic neuropathy are lumped together because they look exactly the same clinically. You cannot differentiate tobacco from tobacco alcohol optic neuropathy because it looks exactly the same. The difference, of course, is when the patient says they don't drink. The problem with that, of course, is you can't trust patients who say they don't drink, but let's just assume it's true. And it's really just the tobacco. The presumptive mechanism of this is the cyanide, which is inside the tobacco smoke. And so that is a toxic optic neuropathy, a direct toxic effect without having to invoke the nutritional component. So to me, tobacco optic neuropathy is a diagnosis of exclusion. It looks just like tobacco alcohol optic neuropathy. It's sometimes called tobacco amblyopia because the fundus is initially normal. You need to test for the usual suspects first: B12, B9, the vitamin deficiencies, an MRI scan, and you have to consider labor, hereditary optic neuropathy, because mitochondrial dysfunction in that papillomacular bundle is what causes the central and secocentral scotoma. Interestingly, patients who have labor hereditary optic neuropathy sometimes have their threshold effect caused by too much smoking. So that is a form of tobacco optic neuropathy in a patient who has the predisposing mitochondrial genetic disorder. The tobacco is the trigger for the threshold effect. And so you need to know a little bit about toxic nutritional optic neuropathies, usually alcohol, but sometimes tobacco alcohol, and sometimes just tobacco.